Recording in progress.
Hey y'all, everybody, and good morning, or whatever time of day. You're allowed to listen to this whenever. That's how podcasts work. Think of the freedom. I'm Dwight, your host here on The Broken Brain, back for our little dive into the intersection of psychology, culture, and health, particularly health today. I'm joined by Dr. Dave Rabin, who is here to talk about some fascinating stuff that is going on we've been focused on terms of like the role of psychedelic medications and psychedelic in therapy and mental health. And we're here today to talk about some of your research that you've done as a neuroscientist, as a psychiatrist, into the use of cannabinoids, and especially when it's instead of opioids. And that's something I've been fascinated about, and I'm really excited to hear about it. So, Dr. Dave, thank you for being here.
It's my pleasure. Thanks for having me.
Now, what can you tell people a little bit about yourself so that they know, who you are and how you got into this messy world of medical health and mental health?
Well, I am, as you said, I am a board-certified psychiatrist and neuroscientist. I practice clinical psychiatry with a focus on holistic psychiatry, and which is like everything we do that's not medication, and then also the like talk therapy and supplements, lifestyle changes, all that good stuff. And then also the traditional medication side. And then I work with technology and psychedelic-assisted therapies, which is a big passion for me because these tools that we have today are to treat mental illness are treating mental illness in ways we've never been able to do before, with much, much higher success rates. I just had an interview with a close colleague, Dr. Jonathan Edwards, who writes and is a seasoned ketamine provider anesthesiologist who writes about the anti-suicidal effects of ketamine, which is a fully legal drug that was discovered definitively in the early aughts. So, we're still not there. We still have a long way to go in the medical profession. And, I have a huge passion for helping people live better lives and feel good and really, access their fullest selves, because I believe, that when we are able to process trauma, physical, mental, emotional trauma, and learn how to do that for ourselves, we actually are able to heal ourselves and get so much more out of life than we ever expected. And these are things that we're all born with. We're born with the skills to heal ourselves. We're born with the skills to be good people to ourselves, to others. We're born with the skills to feel good and to sustain feeling good for extended periods of time, which means not getting sick as often, right? So these are all things that I've learned over the years through my study of neuroscience that we are born with the ability to do. So my passion is really to translate the learnings from neuroscience and other fields of science into practical tools and knowledge and understanding. Apollo being one example of how we can bring healing and feeling good to more people as quickly as possible.
Yeah, we've done a couple of episodes kind of focused on the role of psilocybin. If I said that right, I'm always saying it wrong, but I've decided to try saying it right for a while. But and touching on also some of the things we're seeing with the increased use across the country in the U.S. of legalization. I know the state that I live in, it's only been within the last few years that there's been legalization for medical use. And then there's some that have been doing it for a longer time.
Legalization for medical use of what?
Oh, I'm sorry, marijuana.
Marijuana, right.
Yes. Cannabis in different forms. And so we're seeing just people doing these things so differently. And we talked in several of the interviews I've done, we talked about the bias, obviously the bias and the legal restrictions on research that then, of course, becomes a spiral because it's like, well, I don't know, there's not enough research. It's like, well, it's illegal research. So, you got to be able to do some research to get the data. And thankfully, we're doing that now. And you mentioned ketamine's a big hurdle.
Just a little,
right. Well, and that's the issue. Why don't we get it on both sides? There's the side of stigma of don't use any of this at all with psychedelics or anything. And then there's the other, which is just like, woo. That's what I call it, the woo factor, which is great.
Mm-hmm.
Hey, this is wonderful. It's like vitamin pot or whatever we want to say. You know, there's that other extreme that's like everything's good and healing without actually considering the medical implications of how we use it.
Right.
So you've got these extremes that I think hamper the development.
I mean, I was just going to say it's a perfect example with MDMA assisted therapy because people don't realize that, and cannabis is an interesting example too, but people don't realize what actually happened with MDMA assisted therapy and why it did not get approved by the FDA for legal use for veterans and the millions of people nationwide who are suffering with PTSD. And the reason why this incredibly successful treatment that is akin to it's akin to the discovery of antibiotics in the mental health field. It is literally getting people to sustained remission from decades-long PTSD with just 3 doses. It has very few long-term side effects. It helps the body learn to heal itself again from trauma. Antibiotics help the body heal itself again from infection, right? By weakening the virus or the bug, the bacteria. So there's a lot of similarities, and they both are they're both transmuting an illness that is thought of as life-threatening. PTSD is a lifelong and often life-threatening illness that we have no cures for, and it's inducing sustained remission with just 3 doses and 12 weeks of therapy. That's what antibiotics did for infections back in the 1920s and 30s and 40s, right? So this is what we're seeing in terms of the paradigm shift of how we treat mental illness, which is simply put from a trauma-focused angle. And trauma being unprocessed trauma, mental, emotional, physical, spiritual, what have you, is the single biggest cause of suffering in the world. And this has been known through Eastern and tribal traditions for thousands of years. It's only now coming forth in Western science that it's not, in fact, a serotonin balance causing your depression, like we've been taught for many years. It's, if you weren't born with this, you have somebody who has experienced trauma and who has not processed it properly. That trauma could come from you. It could perhaps passed down from your parents, from your ancestors. There's lots of different ways that trauma learning and fear learning can start to solidify itself in our bodies. But the point is that that's really what we're addressing with these treatments, psychedelic treatments, of which cannabis is a primary tool. Cannabis is a psychedelic. Cannabis, of course, includes THC, which is the psychedelic component of cannabis, the primary psychedelic component, which is Schedule 1, FDA Schedule 1. We are unable to research it because the government has said there are no therapeutic benefits from it, which is obviously not true. That's why most states now have legalized it in some way. But ultimately, all the other components of cannabis, because cannabis is a very interesting and fascinating plant, the hundreds of other plant molecules in there also have some therapeutic benefit in their own way. And many of those are able to be explored in studies and are being explored in studies as supplements rather than as medical products that go through the FDA. So the people are finding their way around. But with MDMA, it's different because it's a single molecule. And to give you an idea of the problem we're facing right now, the major problem is people who are focused on legalization and decriminalization are at odds, as you kind of brought up earlier. Decriminalization is only, and it's really the people on the decrim side that believe that legalization of these medicines is not the best path forward because they don't understand that legalization does all the things that decriminalization does and more. Mm-hmm. Because it allows people like me, who are some of the most well-trained, seasoned practitioners in the field, who have licenses to maintain, to be able to practice this medicine with this medicine. Decriminalization is important because it prevents people from getting arrested when they shouldn't be, and that's the main thing, right? But then what it doesn't do is it doesn't allow me to be protection from being prosecuted by my medical board or by the federal government for using an illegal substance with my patients. So what ultimately happens that as a side effect of organizations like there are many that push decriminalization in favor of legalization or as a priority over legalization, is that legalization for patients and the medical community that allows, again, all the best therapists in the world to use it legally, that gets sidetracked. And then all of the work, all the therapy work with psychedelics, including cannabis, goes to the underground and people use it on their own. And when people are using these medicines on their own without any education, that's when we see the risk likelihood go way up. And with therapy, we can basically eliminate all the risks, nearly all the risks. And then the risks that are left are like basically negligible compared to the risks of SSRIs. But when you take those medicines out of the therapeutic environment and people are seeking them in the real world because they're not getting their needs met by the Western medical community, which is ultimately what's happening now in the mental health space, people end up accidentally hurting themselves or working with someone who's untrained, who says they're good, they're trained, they can do it, and then hurts them, and it re-traumatizes them, and then they have to come see me. And I do their post-psychedelic-assisted therapy, trauma integration therapy, where they've been re-traumatized by a psychedelic experience, and there's almost no one in the country who can help them get back to themselves. And this is all avoidable. And this is exactly why MDMA didn't get through, just to bring it full circle, is because a group of radical anti-capitalist people that goes under the name Symposia with a P decided that they don't believe that veterans have the right to healing because they're part of a capitalist agenda. And so we are going to send information.
Know about that branch of this controversy.
Yep. Huh. Yeah. So this is the big deal, right? So they wrote open letters that have been public for a while and published on socials that they lobbied the FDA and the FDA advisory committee with false information. They don't consider it false, but it is false if you look at what's publicly available. Like what they're saying is not true if you've read the studies and read what MAPS disclosed to the FDA. And they're saying that the treatment with MDMA is riskier than MAPS is letting on. So they insinuate that MAPS, the organization running the FDA trials for MDMA, is hiding things from the FDA, and the FDA, being a risk-averse government organization, says, oh, well, if there's any insinuation of that, then we're just going to make them do more trials, which is what the FDA's job is. It's to protect their agency. So MDMA gets put off. Legalization of this critically important medicine is actually saving lives. It's actually saving lives, and lives of veterans and traumatized women more than anyone else. So look at the populations that are getting hurt. And that treatment gets put off by the FDA for clearance and approval for legal use because a bunch of people who really like to use MDMA themselves and have steady access as much as they want in the decriminalization underground space, they can get whatever they want. So they don't care what happens to patients, especially veterans who are people that they don't believe deserve care, from their perspective. So like that's how devastating these kinds of misunderstandings can be. Legalization does everything that decrim people want. It just does it better than decrim. So we need to focus on legalization first and foremost. That unlocks research. Research that's federally funded. It unlocks clinical providers who have licenses to deliver care en masse, on scale to the entire community of Americans who need it. It allows people to make more equal access to care for everyone. It allows the medicines to continue to evolve, right? And for things to continue to move forward. This literally dropped a fucking anvil right in the middle of the tracks of everybody who was working on this. And it's really tragic and should have been avoided.
Yeah. Yeah. And that's interesting because I'm not as familiar with that part, with the lobbying part, but I am directly familiar with the other part you talk about, which is things going underground. I've even met people who, let's take ketamine, for example. I've met people who, either because of the cost or insurance or whatever, who purchase ketamine and then do their own little web-based research and are administering their own. And it reminds me, like, I've interviewed a couple times with Dr. Stephen Mendel in LA. He's come on the show and talked about this, and he cautions people even from going, because when it became kind of in vogue, a lot of anesthesiologists are like, well, I can open a little ketamine clinic, and he's like, be careful, because whether really inquire as to whether or not they have additional training and whether or not they're members of the sort of associations and things. So that's a doctor that you got to be careful and evaluate, as we probably always should, but to say, but now I'm going to do it myself, just going on a subreddit or whatever. Or
YouTube, watch it on YouTube.
Or YouTube, exactly, right. And to say, so even somebody who is an anesthesiologist who doesn't have the training isn't going to give you the maximum benefit or whatever. And so let's jump right into just somebody with no training just doing it. And this is the part, this is actually, I've been curious about And I've watched this when I see the news about anywhere where I live or wherever, there's always these like kind of like, oh, we're not so sure about, it's got this like, once again, stigma association with marijuana. And I thought, for people to say, well, we just want to make sure, we want to make sure, we want to make sure. It's like, we really have a lot of opiate use. So we have a lot of opiate use that has been legalized, and that we just don't maybe touch that because so many people might be struggling who aren't the people or maybe are the people who are going to be voting, right? That are like, oh, well, maybe I have a social or whatever reason to say, oh, well, the marijuana, that's just bad, right? But I'm dependent on a medication that is actually at this point maybe causing pain, that's not really helping. And so I've been very interested in this looking at chronic pain management. And I'm, curious about some of maybe the comparisons that you'd have, the use of cannabinoids versus opioids.
I mean, it's a big question. We published a major article and clinical framework on this with my team in 2023 in the Harm Reduction Journal, which is called An Answered Call for Aid, cannabinoid clinical framework for the opioid epidemic. So anybody who wants to learn more about this topic specifically, please check that out. Ultimately, what this really comes down to with opioids and cannabinoids is just to look at how they work pharmacologically, right? Like, what is the impact of this medicine on the body? What does it do? What are the withdrawal symptoms, right? And what are the issues people have? And what are the side effects? And so, like, I like to start with side effects first because I try to focus on patient comfort, right? So if people are getting bad side effects from a medication, then we probably need to reevaluate what medication they're on or change the dose or frequency or something like that.
And that's what people are going to throw out there too. It's always when people are arguing against something, they like to compare present things cons to the potential things, or I should say pros to the potential things cons. And so it's good to hit right away and say, yeah, what do we have to watch out for? Yeah.
Yeah. So, and I think so the side effect profile is really the place to start because opioids and opiates have devastating side effects. And we've seen this, right? Major side effect being that is commonly known and recognizable is death via overdose, which is caused by opiates taking accidentally too much opiate when you're not tolerant of it. And opiates suppress respiration. So that's science for decreasing your ability to breathe, right? So now what we've done as a society, in large part because of the pharmaceutical companies misinforming doctors and lying to doctors, of which there was a huge lawsuit you probably heard about, Netflix series about Dope Sick, right? All these things. So because the giant big pharmaceutical companies lied to doctors, lied to the FDA about the addictive nature of oxycodone and some of these other newer opioids, which were just as addictive, if not more so, than the older opioids. Many doctors got addicted and healthcare providers. Many of them lost their lives. Many patients got addicted and lost their lives. And it's probably now over the last 40 years, we're talking like hundreds of thousands of people due to an FDA cleared medicine.
And the FDA, right? Yeah, we don't even like to roll this part in too, but think of all those who become addicted, become dependent, and then because maybe their medical provider realizes they are, or they get a legal charge for taking too much or forging a prescription, all of a sudden now they're in the criminal justice system. There's anxiety, depression, and going out on the street and doing heroin or fentanyl or using alcohol or other sort of things that people do when they can't get a hold of opiates once there's been a problem. So we don't loop those in sometimes when we have this conversation to how many deaths or just quality of life that's been severely damaged, or even just take someone who, maybe they got into treatment and they bumped it down, but maybe here's someone who had a great career before and now they've got 3 felonies on their record, right? And so there's a lot of that loss of life and or damage to quality of life, which is maybe even more frequent than actual death.
Yeah, absolutely. And that's what I was going to say also, is that there is even more side effects in terms of damage to quality of life and community from opioid use and abuse that is not obvious to everyone, right? And so and if you think about that, just that you can die from these medications, and many people do by accident, and they're highly addictive, making you want and feel like you need to consistently be taking more.
Yeah.
Right? Those two things alone, again, I'm an addiction psychiatrist, so I think about this stuff all the time. Most doctors are not trained in addiction. So you just put those two factors together alone, that is a recipe for disaster with people who are struggling with chronic pain, any other kind of pain disorder, right? Those medications, opiates, are not meant to be used every day for the rest of your life. They're not meant to be used long-term at all. They're meant to be used for 1, 3, 5, 7 days, and then you stop. Same with benzodiazepines. These two medicines have those guidelines because they are so highly addictive, but the way they're used in the environment, clinically in society, is very different. Doctors don't have education about these risks, and other nurse practitioners, PAs, many of them who prescribe, they don't have education about this level of risk. And so what do they end up doing is they end up prescribing these for extended periods. People get highly addicted, and they get at increased risk of accidental death and overdose. Cannabis, on the other hand, has zero chance of killing you. You can take like, incredible unconsumable amounts of cannabis to have to do something to you that is seriously bad. You might feel uncomfortable in your body because you are too high from too much THC, but you won't die from the drug. The drug will not suppress your breathing. It won't stop your heart. It won't prevent you from functioning in any way to sustain your life, right? You can take as much of it as you need. You can grow it yourself, right? Talk about decreasing expense on the healthcare system, right? That's so much cheaper than paying for medicine for insurance companies or whatever to pay for medicine every week, every month. There's, cannabis has anti-inflammatory properties. There are ways to use cannabis that don't even require THC, which is what we talk about as a focus in our article, that focus on the non-psychoactive, non-psychedelic cannabinoids to augment pain and healing response and manage pain and to help people taper off of opioids. So all of this has been known actually for quite a long time. Ancient cultures for thousands of years have used cannabinoids and the cannabis plant to manage pain, and hemp extracts to manage pain. Hemp extracts have no THC or not in significant quantities. So this is known. So like what our focus is really, how do we make sure, despite the stigma, let's just dispel the misinformation that everybody has been getting, especially in the medical community, and just hand them a guidebook that's 6 pages long that has a table in it that says, if patients come into you with these issues, cannabis can treat these issues as well or better than opiates, and you don't have to get your patients addicted to opiates. And if they already are addicted to opiates, this is how you get them off using cannabis. And that has never existed before. And that's what we really put together with this article.
We should, and of course, should add, of course, sustained chronic use is going to have other problems, right? But you're right. There's not an overdose, not in the same way, right? There's definitely not an overdose potential.
Yeah,
right. There's addictive patterns and there's different things. And of course there's, again, other long-term health effects if you're ingesting chronic amounts on a regular basis.
But even so, the long-term effects of habitual cannabinoid use are so much better than the effects of opiates, like safety-wise, like it's leaps and bounds. They're not even a comparison. People think about the pharmacological effects of cannabinoids also. Cannabinoids increase insight. They increase awareness. If you take certain kinds of cannabinoids, like high indica strains that dull you out and put you all in your body, then you're not necessarily having great insights. You're sleeping or getting knocked out. But cannabinoids, generally speaking, increase insight. THC being a major component of that. When you have more insight, you have more information about your body, about your environment, about what's going on. You can change perspective on things. You can think. Your brain works, right? Opioids and benzodiazepines work by dulling your faculties. So they decrease executive function.
With benzos being long-term, benzos, for anyone who's not familiar, those are what you're usually talking about if you get prescribed something for anxiety. Now, sometimes those are SSRIs or other antidepressants that might secondarily affect your anxiety. But oftentimes, if we're talking, here's the thing you take to calm down, that if you are taking long term, many prescribers that I know won't even, they'll only do it like you said. Here's something, if you need something to lower your anxiety, to keep from becoming suicidal short term until we, through therapy or other ways, stabilize that. Yes, it's better than benzos are better than suicide, but we're talking about that comparison at that point. Better than suicide.
of which ketamine is substantially better than any of these alternatives we're talking about, right? Ketamine is cannabis cannabis and ketamine have similar safety profiles in general. Cannabis is safer than ketamine because ketamine is an anesthetic that can knock you out if you take too much. But ketamine is the safest psychedelic that's legal, federally legal. It's by far, hands down, the safest. It's used in children. It's used in pregnant women for surgery. It's used, in all populations, and it has potent anti-suicidal, antidepressant effects.
And that's the big thing I've found, both anecdotally with people I've known and just from reading the research, that a huge amount of people benefit quite a lot and their depression goes way down. But even amongst those who don't as much benefit from that, the suicidality seems to, for the vast majority, just doesn't come back, even if they still struggle, with, and of course, it's a management tool for depression. Many people still have other treatments, obviously, too. I'm curious about, here's one piece of this that I think the stereotype is, you go get a medical card, you go to a doctor and say, I got some back pain and now I can smoke pot, right? That's the sort of jokey stereotype, and not, that's part of an approach to say legalize use, and especially in an area where it's only medically authorized. What we don't hear very much about is in sort of working with the medical provider for dosing instructions. I don't see that around here, where people will ask maybe a doctor, so how much should I be taking if I'm managing pain, for example, or if I'm, I've known people who've taken its reduced panic flashbacks, nightmares, things like that. It's like, but how much and what type and what route of administration? That's, once again, subreddits or talking to, there's helpful doctors who work for the dispensaries sometimes or whatever, but I don't
rarely
know anybody. Exactly. That's a business thing, right? There's an element there that's maybe a dual interest, maybe. But anyway, I'm really interested of how do we go about that with training, or is that something that should be there? How do you approach that?
So there aren't really good guidelines yet across the board that exist that say, if you have this issue, use this kind of cannabis. There's certainly, or cannabinoids and this dose, there is evidence in the community of people who have done research on these medicines and on some of the synthetic, like pharmaceutical grade cannabinoids, that gives us a lot of understanding of what dosing should be to give people the best possible outcomes with the least possible risk. The major risk of THC, the major risk is paranoia. And it usually happens in people who have anxiety, who are not ready for the experience, or in anybody who could take too much by accident and get a little hypercritical, a little paranoid, a little worried when you shouldn't. It goes away. It goes away usually in a few hours. So that's and you can, and you can breathe it away by doing some deep breathing exercises. So that's a major risk, but dose is everything, right? And there aren't any, most of my patients who come to me, who tell me they use medical cannabis, tell me that their dosing recommendations and what cannabinoids they should use came from the bud tender at the dispensary, right? Not from a doctor or any kind of expert. And these people, the people at dispensaries,
the guy behind the counter isn't, there's a doctor in there somewhere, but, usually you see them once again to get your card authorized or for some liability thing or something, and nothing against, I'd love to hear it, and of course I'd love to hear from anybody out there who's working in this industry. But overall, that's not the same as sitting with your doctor and saying, that's why you go to a separate, whatever. But to have somebody who's like that, and contrary to what people might think, I think people who have a perspective that, there's this legalized use, it's just people using something to say, here's another route to get high recreationally. I'm not going to say that doesn't happen, but when I work with people who are taking it for, say, mental health, or I work with a lot of people with chronic pain, even though I'm not their pain provider, we might be working on the psychological aspects, but they're trying this themselves. They're saying okay, I'm not trying to get really high. I'm trying, if I eat a quarter of this gummy, I seem to have this effect. But if I change brands and strains, whoops. And a lot of times people don't come to this with a tremendous amount of experience, right? Anyway, that's very interesting. So that's something that is being, like, how do you work on that? How do you develop these things? Or is it too individualized in metabolism and
no, it's not that. It's not that individual. I mean, there's certain metabolic things people have coming in that we know, hey, you're going to be more, or psychological states, right? Like we know you're going to be more likely to have a quick response to cannabis versus not. If you've had experience with cannabis, you're more likely to respond quickly. If you've had, there's other things, right, that are clues that help us. People with anxiety, I mentioned very strong anxiety, generalized anxiety, not good candidates for THC, Delta 9 THC, but great candidates for almost all the other cannabinoids, right? So understanding somebody's profile a little bit coming in, that's what we do as doctors, right?
Right,
that helps us tailor the treatment to the individual. Unfortunately, what I found through the last several years of my work, talking to hundreds and hundreds of doctors around the country about this, is that most people have no fucking idea how to have a conversation about psychedelics or cannabinoids with their patients. And so that's a big part of why patients are just going out and taking it on themselves, doing it on their own, taking extra risks that could be avoided because they're going to dispensaries that are selling super high Delta 9 THC containing cannabis for mostly recreational users that is not designed, grown, packaged, etc., for therapeutic use. So for anybody who wants to learn about this, again, there aren't a lot of good resources out yet that are evidence-based, but you can go to the boardofmedicine.org website, which is our nonprofit, the boardofmedicine.org. And you can see we have a clinical cannabis initiative linked there, which is one of our major focuses, because cannabis is such a life-saving plant. And all the hundreds of molecules that exist in cannabinoids, many of them have been not adequately explored, but they also seem to be very therapeutic. And so we put together guidelines that are not just for doctors, but for anyone. You can go to our clinical cannabis initiative, you can scroll down, and you can understand very quickly looking at that table how much and how much dose and what cannabinoids I should take to get started. And that's enough for most people.
So that's really useful because, once again, if you're not just talking to some friend with more because often it's going to be recreational. If you talk to a friend with some experience, if you're lucky, maybe you talk to someone who went through kind of the research or the trial and error to get to the point that you just said. Once again, though, you're rolling the dice. And so that's quite interesting. There's a resource people can go that's actually being put together by researchers and doctors. That's useful.
Yeah. Again, and there's more coming.
Yeah.
There's more coming, but we're still in the early days of bringing psychedelics and cannabinoid medicines into Western medicine to be fully accepted. And they're still, as you said earlier, right, federally illegal in many cases. So we don't have the ability to do all the big scientific research studies on these tools that we want to and we need to, which is a tragedy, because why should the government tell doctors and scientists what's safe to study and what's not when they willingly hand out opioids to an entire population and benzos and, many, many other more harmful, toxic medications that are literally taking people's lives. I mean, at some point, I think all it takes is enough people standing up and raising their hands, including healthcare providers, that says, hey, we won't stand for this anymore. We're not going to stand for this anymore. People need help. They need care. And these tools are here. At the very least, let us research them.
What kind of guidance do you give to people to be part of that if they want to advocate? What are some effective routes of advocacy that they really say, whether it's a consumer or a provider of healthcare? And I guess technically everybody who's a provider is also a consumer. Everybody's a consumer of healthcare. But do you have any feedback or guidance for people of how to be involved in that?
Yeah, I mean, I think the number one thing is spreading awareness of the problems that we can easily overcome. Like, I think the good news is these problems we're all talking about are easily overcomable problems, but there's a lot of bureaucratic, old bureaucratic stuff in the way. And I think a lot of the people who are working in these areas in the government, even, I think they want to see these problems solved too. So I don't think they're bad people. I just don't think they understand the problem that we're facing and what it would take to make that problem have solutions, right? And so the first step is just spreading awareness, right? Just telling everyone you know about how exciting it is that we're right around the corner from these great discoveries using plant medicine and psychedelics, including cannabis, to solve all these mental health problems or to really make a real dent for the first time in decades. We're right around the corner. Everyone should be knowing about this. Everyone knows somebody who has mental illness or who's struggling with something. They need to know about this, right? Everybody needs to know. So the first step is just talking about it, spreading awareness, sharing resources that are helpful if they want to learn more. Our psychedelic news show goes into depth and leagues of depth on all of this stuff. If anybody wants a reliable source, called the Psychedelic Report. Okay. And the second thing is to write the DEA and the FDA, right? Like, I know it sounds like an old school method, but like, these people need to hear from you. And every clinician that has the ability to write a letter, and every single person who knows somebody with mental illness, who treats people with mental illness who are not getting the results they need or deserve, needs to pick up a pen or go to their computer and write a letter that says, we need to make research on these tools legal. We need to make research on these tools legal, and we need to make the tools themselves legal as quickly as possible so that we can actually solve some of these public health problems. You know, my dad's hurting, I'm hurting, my uncle's hurting, my neighbor's hurting, everybody's hurting. So if we're all hurting, let's like stand together and tell the government what we want. Yeah. You know, they'll do it.
It's interesting. It's the same approach as like writing to your congressman or senator or whatever. So that's interesting to write to an agency. I think is something maybe I think people might would not have thought of, and so it's good to put that out there. It is exciting, and it is good to see, especially since a lot of this is being done with patient care in mind, and trying to break away from some of the hugely negatives that aspects that have really plagued our culture. I just did an event for Opiate Overdose Awareness Day, just a couple weeks ago. And we do it every year, me and some other like kind of podcaster and then clinician friends, talking about how this becomes such an endemic part of our society, and to say, but yet we'll protect that. And it's like, no, we need to make sure that there's something to replace it with, because going back just to the foundational addiction treatment thinking, if you don't address the reason why I need the thing, I'm going to keep doing the thing, whatever the harmful thing is. And so if we find alternate ways to treat that, that's the modern approach, and that's very, very necessary. So, well, I'm really grateful to be able to hear this from you and be able to share this with everybody out there. I want them to know where they can follow your work. You mentioned a couple things. I want to get a more specific sort of point of following they can go to. But first, I always like to ask people if they have a method of giving back to the community that they like. And it could be a nonprofit, it could be a charity, or it could just be a cool idea or of a thing to do to people around. It doesn't have to be related to this, but it can be. But is there anything that you would share with the listeners?
In terms of like a nonprofit?
Yeah.
Focus? Yeah, I mean, I would suggest that anybody who is interested in this area and this work we're talking about, which is groundbreaking for mental health, and who wants to see this continue to move forward, check out theboardofmedicine.org. You can donate to the Board of Medicine. We're a 501c3 nonprofit. We are run entirely, all the world-renowned doctors that work with us are all volunteers, as well as am I. And we really just are passionate about improving public health and in disseminating this knowledge to the community as soon as possible. And it literally is a money issue. So the sooner that we can bring in any kind of donations from the community that wants to support us, big or small, doesn't matter. That helps us fund these types of very powerful educational tools, like that paper on how to use cannabinoids to treat the opioid crisis, that otherwise wouldn't exist. So we're literally updating the medical field as we go, the Western medical field, with the latest information. And I haven't seen a single other group out there doing this in this way, focused on these critical tools. I just haven't seen it, and that's why we decided to do it ourselves. And so any support is welcome, and all those donations are tax deductible through our nonprofit.
Okay, great. Is that the best place for people to follow your work, is through there, or do you have another kind of point where they can follow what you're doing?
Yes, you can. So you can definitely see some of my work on the Board of Medicine website. You could also find me directly at my clinic website, which is drdave.io, or apollo.clinic will also work. You can check out my technology that we translated from neuroscience to give everyone access to feeling good with gentle sound wave vibrations on apolloneuro.com. You can also go to wearablehugs.com, which is what the kids call it. And then come find me on socials, Twitter and Instagram at Dr. David Rabin.
Good. Well, thank you. I want to give a quick little reminder to everybody out there as well, to make sure that you are aware of the every month we have a charity of focus, and I believe you heard that up at the top of which one it is this month. And this, I say this when I don't remember which one this is going to be. So I have some little bit stingers that go up top. And so you've already heard that at the beginning of this episode of this month's Charity of Focus. Remember that if anyone chooses to become a patron of the show, that you can go directly and interact with that nonprofit, obviously. But if you decide that you want the bonus materials from the Broken Brain and things, and you sign up, 50% of whatever you donate, as long as you are a paid member, will go to the Charity of Focus in the month that you joined. So to remind people of that as a way to get involved with the show or the charity, or, either one or both, or whatever y'all want to do. So, well, Dr. Rabin, thank you so much for being here and for the work you're doing.
It's absolutely my pleasure. Thanks so much for having me.
Thank you for listening to the Court Arts Podcast Network. To listen to more Court Arts shows, visit courtemparts.com.